Thank you very much, Mr. Speaker. Honorable members, I rise to present the Human Organ and Tissue Transplant Bill 2021 for its second reading. This bill seeks to create an enabling legislative framework for cell, tissue, organ, biofluid transplantations, and for blood transfusion, the development of regenerative medicine, and the expansion of medical education and scientific research. Organ transplantation is not a new phenomenon. For more than a century, surgeons have replaced diseased organs with healthy ones, and in the process have been able to perfect surgical techniques, organ preservation, tissue typing, and now even we're doing xenotransplantation. Over the years, transplants have helped to extend the life expectancy of many patients, and as expected, and has been accepted as the best therapy for patients with terminal and irreversible organ failure. In 2020, the Global Observatory on Donation and Transplantation estimates that there were 129,681 solid organ transplants which were done in the world. 80,926 kidneys, 32,586 livers, 8,101 hearts, 5,940 lungs, 1,970 pancreases, and 158 small bowel transplants. Mr. Speaker, all the experts agree that transplantation is the best therapy for patients with end-stage organ failure. After a successful transplant, the patient's clinical condition would significantly improve, along with the attendant comorbidities. These clinical changes help improve the patient's quality of life, and in many instances, these patients can return to everyday life and improve life expectancy. Several studies have shown that for patients with end organ failure, that transplant is often the most cost-effective form of treatment. Mr. Speaker, philanthropist, the late George Sobraj, was a very strong advocate for organ transplant. He funded several medical missions to Guyana, first to assess the state of patients with end-stage renal disease, and then to work on the development of a dialysis program, which eventually led to the first kidney transplant by Dr. Raul Jindal and his team on the 12th of July, 2008. Between 2008 to 2014, there were 30 kidney transplants using living donors that were done here in Guyana. These early transplant surgeries were done at the Balwant Singh Hospital. These pioneering surgeries give hope to a lot of patients, but it also inspired many of our local doctors to take up the field of transplantation. One such doctor, Dr. Kishore Prasad, was sent to Canada to train in organ transplantation. And upon his return in 2015, the Georgetown Public Hospital Corporation established a transplant unit under his leadership. The GPHC team has successfully transplanted 36 patients who were diagnosed with end-stage renal disease. The survivability of these patients have improved tremendously. This program has given hope to patients with end-stage renal disease because many of them can now access this program. Currently, Mr. Speaker, there are close to 200 patients receiving dialysis, requiring at least 3 sessions per week. Many of these patients are unable to work because of the type of illness that they have, and transplant would certainly be able to change the outcome for these patients. Mr. Speaker, the successes of our homegrown program have attracted Caribbean-wide attention. You would recall that in July last year, Dr. Bristol of Grenada came to Guyana, came to the Georgetown Public Hospital, and had a successful kidney transplant that was done there. At the press conference, she said that to receive such a surgery in other jurisdictions would have cost her close to $400,000 US. But we did it here in Guyana for free. Since this type of surgery, right now, several other countries are now inquiring whether they can send patients to us here in Guyana. Mr. Speaker, apart from solid organ transplants, such as kidney, the George Subraj Foundation also funded a corneal transplant program. A corneal transplant replaces a diseased cornea with a new one. When the cornea becomes cloudy, light cannot penetrate the eye to reach the retina, and therefore that person would have poor vision, often resulting in blindness. In corneal transplant, the surgeon removes the central portion of that cloudy cornea and replaces it with a clear cornea. This program also was started by Dr. Jindal, but was aided with but was also done with the help of Dr. Joseph Pasternak and Stephen Waller, who initially in 2014 performed 6 corneal transplants, again at the Balwant Singh Hospital. The transplanted corneas were acquired from an eye bank in the United States, and after these successful surgeries, the program was transferred to the Georgetown Public Hospital. Dr. Shailendra Sugrim and a local team of doctors were trained on corneal transplantation techniques. To date, the local team spearheaded by Dr. Sugrim have completed 93 corneal transplant surgeries right at the Georgetown Public Hospital. Cornea transplantation, Mr. Speaker, corneal transplantation has been a game changer for many patients who a generation ago would have been blinded permanently. They now can have their sight restored with a corneal transplant. Currently, the cost of such a transplant ranges from $13,000 US to approximately $27,000 US. Unfortunately, the cost of a cornea is very prohibitive for most patients. This legislation would allow the development of a local eye bank which would recover and store ocular tissue from donors for transplant to eligible recipients. This measure would assist hundreds of persons in regaining their sight at a very affordable cost. Mr. Speaker, we all know that blood transfusion is a very indispensable part of the practice of medicine in Guyana, both for medical purposes and for surgical purposes. Before 1990, there were several private and public blood banks which collected and transfused whole blood. This was a very inefficient use of blood, and in many instances, did not allow for a robust standard in preventing transfusion-transmitted infections. In the 1990s, a national blood transfusion service was developed in the public sector with the assistance of the World Health Organization, the European Union, and later the US government through the PEPFAR initiative. In the early 1990s, Guyana was able to move away from whole blood, and we have started doing the separation of blood components, such as red packed cells, platelets, and plasma. And then in the 2000s, with the funding from PEPFAR, we developed a robust program to prevent transfusion-transmitted infections, such as hepatitis B, hepatitis C, HIV, cytomegalovirus, syphilis, human T lymphotropic virus, Chagas, malaria, and microfilaria. Mr. Speaker, the blood bank can also now produce specialized blood products, such as leuko-reduced packed cells, platelets, pooled cryoprecipitate apheresis platelets, and wash red cells. We have also changed the pattern of blood collection from families of patients donating most of the blood to moving to 98 to 100% voluntary blood donation. There's no doubt that transfusion medicine has saved countless lives in Guyana. Now the blood bank is contemplating the next wave of development, and that is to do blood fractionation. That is, to look at various fractions of the blood, such as to be able to produce factor VIII, which is necessary for hemophiliacs, without which, if they don't get the factor VIII, they can bleed to death. Mr. Speaker, while we have transfused blood for several decades, and we have been transplanting kidneys since 2008, and we have been transplanting corneas since 2014, there has been no legal framework in place to regulate the donation of blood, organs, cells, or tissues. This legislation is now going to put that framework in place so that this can be done ethically and safely and in keeping with the global best practices. Mr. Speaker, transplant medicine and transfusion medicine has undergone extensive transformation. In the early days of transplant medicine, surgeons struggled to prevent organ rejection. Immunology research has given us new knowledge on how to successfully suppress the recipient immune system using immunosuppressant medicine. Newer techniques are now paving the way to grow organs and to prevent rejection. We are now transitioning from the traditional way of doing transplantation into an era of regenerative medicine. New research is now pointing the way to that future of patient care. In a book on organ repair and regeneration, Paula Griselis and team describe how the transplant landscape is changing and how it's moving away from the traditional to regenerative medicine. And I just want to give a little quote here. And that is, they said, progress in cell and extracellular matrix biology, in biomaterial science, and in the developmental biology, in cell and tissue physiology, have paved the ground for the development of technologies that, when mature, will enable organ on demand, whereby organs will be manufactured for patients using their own cells. When this is achieved, Mr. Speaker, no immunosuppression would be needed, no waiting lists would be necessary, no preservation of organs would be required, as these organs, tissue or cells, would be manufactured on demand and implanted immediately. This bill would allow us, our scientists, our researchers, our clinicians, to start researching and exploiting the benefits of regenerative medicine. Mr. Speaker, one of the applications of regenerative medicine is cell-based therapies. Cell-based therapies treat, repair, replace diseased organs and tissue with new and healthy and functional ones. The discovery of stem cells and their capabilities, their capacity for self-renewal and differentiation has led to cell-based therapies, drug discoveries, and tissue engineering. Currently, cell-based therapies are used to treat hematological disorders such as myeloid leukemia, lymphoma, sickle cell anemia, immune deficiencies, and beta thalassemias. It has also been used in wound healing and skin injuries. It has also been used in neurological disorders such as Parkinson's disease and spinal cord disorder. It has also been used in autoimmune disorders such as multiple sclerosis, rheumatoid arthritis, Crohn's disease, and type 1 diabetes. Cardiac diseases, including ischemic heart diseases, have also benefited from cell-based therapies. And ocular disorders, such as macular degeneration and retinitis pigmentosa, have also benefited from this type of therapy. Bone diseases, such as osteosarcoma, osteoporosis, and osteoarthritis, are also targets for cell-based therapy. Cell-based therapies, Mr. Speaker, are among the most exciting and revolutionary medical advances in the 21st century. It is providing new hope for many patients, and this bill provides the use of this type of therapy in Guyana. Mr. Speaker, this bill is in keeping with the revised WHO guiding principles on human organ and transplantation, and all 13 of these guidelines are reflected in the various sections of the bill. The bill will establish a human organ and tissue transplant agency which will oversee all future transplants of cells, biofluids, tissue, organs, and organs in Guyana. It would also establish a national donor and transplant registry so that we can manage this process very effectively. The registry would have a list of persons who have consented to donate their organs, and it would also have another list of persons who require these donations. It also prescribes the eligibility criteria for live adult donors before they can enroll, what are required before they can enroll into the registry, and depending on the type of donation that they're doing, whether it's a regenerative or a non-regenerative organ. It also provides for live minor donors or their parents or guardians who can give consent, but only for the removal of a regenerative organ. And each case where consent is given, we also have to get the assessment of an independent assessment committee to determine whether to proceed or not to proceed with such a donation. These safeguards are in keeping with international best practices. Mr. Speaker, this bill also allows for donation of organs after the patient dies. Section 9 deals with all issues relating to such a donation. And again, in this section, there's the appropriate balance of the principles of altruism, autonomy, dignity, futility, and equity. Mr. Speaker, this bill also makes it compulsory for anyone who would be donating must give consent. Consent is a fundamental component of this bill, and the details are clearly outlined in Section 5, 6, 7, as in the case for live donors, and Section 9 for those patients who die. Mr. Speaker, it also provides that if individual consent is not known, and a next of kin would have to indicate their wish to proceed with the donation. These sections of the bill cover the activities for which consent is required and the conditions of consent and how to withdraw that consent. And at any time, if any one of the persons listed would like to withdraw, they can do so. The bill also formally establishes the National Blood Transfusion Services Department. This department coordinates and manages blood transfusion services throughout Guyana. They would be responsible for the establishment of blood banks, manufacturing various blood products for blood transfusion, and managing a voluntary donation system, and having a robust approach to prevent transfusion-transmitted infections. Mr. Speaker, this bill also creates new offenses for a person who attempts to trade in cells, tissues, biofluids, blood, or organs. In some countries, Mr. Speaker, donated organs may be purchased legally or illegally, and this has led to vulnerable persons being tricked or coerced into donating their organs. This section of the bill is in keeping with the WHO guidelines and would prevent such practices from ever occurring in Guyana. Mr. Speaker, in designing the bill, the drafters at the Attorney General Chambers ensured that we followed all the international best practices, especially the WHO guidelines. We have benefited also from the advice and expertise of PAHO WHO and from transplant programs in the European Union, the USA, and Canada. And I'd just like to single out a few people, Mr. Speaker. I want to thank Dr. Stephen Guy and the team from the Subraj Foundation who offered very useful advice and comments on the draft bill. I would also like to thank Professor Kishan Narayan, an associate professor of cardiac surgery in the Department of Cardiac Science, Libyan Cardiovascular Institute of Alberta, and formerly the co-director of the Cardiac Transplantation Program in Belgium. I would also like to thank Dr. Nevin Narain, the co-founder and president and CEO of BERG. He serves as an advisor on the board at Harvard Law and Policy, Biotechnology and Bioethics, and he has been able to provide us with very useful advice. Dr. Maria Paula Gomes, DTI expert, that's Donation Transplantation Institute expert, and medical coordinator of the International Registry for Organ Donation and Transplantation. And she also provided very useful advice to us. Dr. Sedar Yilmaz, he is an expert with over 24 years in organ transplantation, and he is a multi-organ transplant surgeon at the University of Calgary in Alberta. Dr. Narendra Singh, consultant of pediatrics at Humber River Hospital and an associate clinical professor at McMaster's University. Dr. Hasina Mohammed, resident in anesthesiology and intensive care, and the person responsible for the procurement, the transplant procurement agency in Trinidad and Tobago. And Dr. Brittany Dingley, surgical oncologist, the Ottawa Hospital. Mr. Speaker, we also benefited from a number of the local experts who provided leadership in pushing for this particular bill and whose practice this bill would directly affect. And they include Dr. Alexandra Harvey, the anesthesiologist and director of the Institute of Health Sciences at the Georgetown Public Hospital, Dr. Kishore Prasad, the head of Department, Multi-Organ Transplant and Vascular Access Surgery, GPHC, Dr. Bolan Prasad, medical officer, Multi-Organ Transplant and Vascular Access, GPHC, Dr. Onika Higgins-Gill, anesthesiologist and intensivist, Dr. Pedro Lewis, the head of the National Blood Transfusion Services, Dr. Shailendra Subrim, head of ophthalmology at the GPHC, Dr. Marissa C. Prasad, head of pediatric surgery, GPHC, Dr. Navin Rambaran, chair of the Guyana Medical Council and head of department of the general surgery at GPHC. In addition, Mr. Speaker, in addition to the medical experts, we have also had local and international legal experts in the field of transplant surgery. These international experts include Joan Navarro, a legal expert on transplant and donation, a legal expert on transplant from the Donation and Transplant Institute in Spain. Professor Ellie Gange, a human rights lawyer in Calgary, and we have also benefited from a review of the law by Professor I. Glenn Cohen, the James A. Atwood and Leslie Williams Professor of Law and Deputy Dean of the Harvard Law School. He is currently the Faculty Director of Petrie Flom Center for Health Law Policy, Biotechnology, and Bioethics, and he did a thorough review of this particular piece of legislation. Mr. Speaker, we also had the local legal team that was spearheaded by our own Attorney General, the Honorable Anil Nandalal, and his team at the AG Chambers, including Ms. Amanda Dujon and others in the chambers. We have also benefited from comments by Medical Council member and Attorney at Law Kamal Ramkaran, and there are many others who would have contributed to reviewing and making comments on the bill. Mr. Speaker, it would be remiss of me if I do not also thank you, Mr. Speaker, for the work that you did in organizing several of the Zoom meetings that we had with a number of stakeholders, including those stakeholders from the Subraj Foundation. Mr. Speaker, I would like to express my gratitude to you and the other persons who would have given us those very valuable comments. These wide-ranging consultations, Mr. Speaker, have allowed us to develop one of the region's most comprehensive legislation on cell, tissue, organ, biofluids, transplants. and one of the most advanced legislation